For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. Good morning, everyone. Buenos días. Thank you, Governor Newsom, not only for joining us today, but for taking the time to visit a number of vaccination centers throughout the state in recognition of the scale and commitment that go with protecting 40 million Californians in an equitable way. At Altamed is currently vaccinating patients at several of our offices across Los Angeles and Orange County. For more than a decade, we have been a trusted medical provider and partner in Orange County, where at least 35% of the residents are Latinos, and the hardest hit population, and one which continues to be at the highest risk of contracting COVID-19 due to the essential role in sustaining the economy. We are proud to serve a diverse population, and through this pandemic, we have witnessed the unjust impact of the social vulnerabilities that they face. We understand the importance of creating equitable access not only to COVID testing and vaccinations, but to primary care to our patients and communities. Among those we serve, 66% of our patients and their families live in areas ranked in the highest 25% of crowding in California. 54% of our patients and their families live in areas where income falls at the bottom of the 25% among Californians. And 37% of our patients and their families live in areas that rank in the top 10% of areas with limited English proficiency. It is incredibly important that vaccines are quickly and efficiently rolled out and made accessible to every member of every household where they are eligible. That we promote the availability of vaccination dates and locations in the right language and by trusted messengers within each community. Accessibility is absolutely key to helping Californians safely return to normal. We must also acknowledge our systemic barriers like transportation and access to culturally and linguistically aligned providers in communities large and small across the state of California. Altamed has administered more than 8,000 vaccines in Orange County alone since we began vaccinating our patients in February. By design, community health centers are we are perfectly positioned to vaccinate our communities because this is already part of our primary care services at our facilities. For decades, we have met our communities where they are, and we will continue to do so as long as it is necessary. We have set up hotlines in English and Spanish and other languages, as well as provided phone banks to respond to the questions and assist their patients with making decisions with regards to vaccinations. We have always been a proud champion of accessible, affordable healthcare where it's most needed. And we are proud to be champions and looking as we roll out a safe and timely rollout of vaccinations. And we are particularly proud of our relationship with the governor and his staff. And I got to tell you, this man has been a champion for our communities. Not an easy task under any circumstance. Not an easy task to manage a pandemic in the times that we are living today. So, Governor, thank you very much for the outstanding job. It is indeed my pleasure now to introduce to you a gentleman that really does not need an introduction in this community or elsewhere in the state of California. It is my great pleasure to introduce to you the mayor of the city of Santa Ana, Mayor Sarmiento.
Muchas gracias, Castulo. Welcome, everybody. Good morning and welcome to Santa Ana. Governor, welcome to the county seat here in Orange County. We are very happy to have you here, but more importantly, we're very grateful on behalf of all the residents, especially here in Santa Ana, to have you here in our community. You know, we now have a sense of hope, ever since the governor has directed our healthcare agency to focus in on the Healthy Places Index and realize that many of the communities have been hard hit, and there was a disparity in connecting resources to need. So Orange County has always had the label of being an affluent, homogeneous community. It really isn't. It's an evolving county. And especially here in Santa Ana, as Mr. De La Rocha was saying, we have some of the highest indexes, not only of COVID, but also folks that live under the poverty line. We have many of our community that are renters and tenants. They struggle every day, but they're also our essential workers. They're the ones who've been going out, working, making our economy function, and doing it under some very difficult conditions. They don't have the luxury of remotely working or working from home. So they've had to go out and then come back to their homes where they live in overcrowded conditions, sometimes multi-generational households. And then you have folks there that already had pre-COVID chronic health conditions. So this was the worst formula for some bad things to happen. So many of us saw this on the horizon. But I'm very grateful because we're blessed in Santa Ana to have so many partners and strong voices that when we saw the numbers raging in some of our zip codes, 1 in 4 people were testing positive. You had people from the school district here. My colleagues on the city council, my mayor pro tem is here, and others, and members of the college trustees, one of which is here. And folks from, community leaders and nonprofits and our community clinics, all those voices started to, get more vocal. And I think everybody heard. And I think the game changer was when the governor said, hey, we have to dedicate 40% of these vaccines to those communities that haven't been addressed. So we are eternally grateful for that because we were seeing that resources were going elsewhere. And as we always say here, relief delayed is relief denied. And so I think that now is, getting under control, and we're hopeful here. And we're extremely hopeful for all the ancillary support that's being provided to our tenants in rental assistance, to our small businesses, that many of which failed and are struggling. So those business grants, those resources to our renters and tenants, and getting our kids back to school safely. All those things are is a formula for recovery. So we are very optimistic. We are very hopeful. Governor, you had our back here in Santa Ana. We promise to have yours. We want to make sure that you know that you can count on us as being partners with you in this. It's not a sprint, it's a marathon. And we know what's going to follow the public health crisis is the economic recovery crisis, right? It's going to be a difficult one. But know that as we've done this collectively, we're going to continue to move forward collectively and be successful. We live in one of the greatest states in the country, right? We see other states that are going sideways a little bit with their numbers, not us. So we want to thank the governor and his team for coming here to Orange County and for showing leadership here. And look, with no further delay, I'm just very, very happy to introduce the governor of our great state of California, Gavin Newsom.
Thank you. Thank you, Mr. Mayor, and also thank you very much, all the Ultimate team. Thank you for the privilege and the opportunity to be with you today, Mr. Mayor. Thank you for not only your generous words, but thank you for raising the bar of expectations. The mayor's been very pointed, and appropriately so, in terms of his desire and demand that we do more for those that have been most acutely impacted by this pandemic. To put it in terms that are more easily digestible, to do more for the Latino community that has been disproportionately impacted in terms of total number of cases and deaths related to this pandemic. We needed to do more. We needed to do better. The mayor wasn't shy about making that known publicly and privately, and appropriately so. And because of his voice, because of his leadership, because his desire to truly deliver on what we were promoting, equity, we were able to do just that on March 4th by acknowledging that the pace we were going, we were not going to do justice to our North Star, and that was addressing equity as it relates to vaccine administration and distribution. Now, that said, we still have a lot of work to do. We are mindful of that. We recognize we're not even close to where we need to be, but we were the first and the most bold state in America to lay a marker with that 40%, to commit to a cause, to truly be accountable and more transparent to delivering in communities large and small all across this state. And we're seeing progress every day on that goal. 30% increase in what we refer to as these healthy place indexes, the lowest quartile in terms of administered doses, but that's not enough. And we are mindful in an effort to do more, we've got to provide more partnerships with organizations like this, more opportunities and more points of engagement, not only with community-based organizations, but incredible leadership that is demonstrable in an organization that truly is trusted in communities all throughout Southern California, in particular here in Orange County, but also in LA County, and that's Ultimate. And it's a remarkable thing to see, to see generations, families. We were just downstairs, mother that was vaccinated, and a daughter that was coming in to get vaccinated. We were hearing stories. You were kind enough to offer stories about how 10, 12 folks would come in, one vehicle, all to get tested, only to find out everybody in that vehicle was testing positive. The ravages of this pandemic, not only identifying people are positive, but having to follow up to find out, as it was stated, people have literally lost their lives because of the deadliness of this pandemic. So it has been a challenging year. It goes without saying, but there really is, and Mayor, thank you for making this point. There's not just light at the end of the tunnel, there's bright light at the end of the tunnel. Just 48 hours ago, we passed 15 million administered doses, now over 15.5 million, closing in on 16 million doses. That's close to 6 million more than any other state in the country. We are administering more doses than all but 5 other nations in the world. We distributed last week, or rather administered 2.5 million doses. We only received 1.8 million doses. Our only constraint is manufactured supply. We built out a system in this state where we can conservatively administer 3 million doses a week. By the end of next month, we'll be able to administer 4 million doses a week, with the expectation that more supply will be made available, more J&J supply, one shot, but also more supply as it relates to Moderna and Pfizer. That expectation has set up a framework where today we are announcing that we are modifying in a stair-stepped manner our eligibility for administered doses here in the state. On April 1st, in the state of California, anyone 50 and over will be able to get a vaccine in our state. So next Thursday, anyone 50 and over will be provided the opportunity to get a vaccine. On April 15th, everybody in the state of California 16 and over can get a vaccine. So in just a few weeks, there'll be no rules, no limitations as it relates to the ability to get a vaccine administered. April 1st, everyone 50 and over. April 15th, everybody 16 and over. We also today are loosening the requirements to provide Ultimate and others the ability to use their discretion, effective today, regardless of your age, regardless of your pre-existing condition. If someone comes in eligible under the existing rules, but with a family member, we will accommodate the family member, no questions asked. That flexibility is effective today as well. bright light at the end of this tunnel. This comes with the expectation of more manufactured supply. This comes with the expectation we'll be going from about 1.8 million doses a week to about 2.5 million doses in a number of weeks, and closer to 3 million as we move into May, June, and then the abundance that President Biden has spoken about. So I hope this is coming as positive news for those that have been waiting their turn. And by the way, that includes myself. I will be eligible after next Thursday, and I look forward to getting the best shot. And the best vaccine is the next one available, whatever that vaccine is. And I would encourage those of you that have not yet done so to take the time, go on the My Turn app, fill out the form, learn about the site and location that's proximate to you, and work through the scheduling. And we are now working with providers all up and down the state to prepare for a surge of access and demand once that limitation as it relates to the current tiering is lifted. That said, Mr. Mayor, that said, Mr. President, we are not walking away from our equity commitments. Quite the contrary. We'll continue to double down on all of those equity frames. We're not running the 90-yard dash on that. That wasn't just an announcement and we're moving on to the next thing. We truly want to flood those areas. And that's why that accessibility as it relates to multi-generation or extended family members is 4 areas that are in that equity frame. That's the commitment, again, of reinforcing an equity mindset in a meaningful and demonstrable way. Just a few quick top lines. Yesterday, we announced another 9-10 counties now moving out of lesser restrictive tiers, or more restrictive now into lesser restrictive tiers. Now 50 of the 58 counties are out of that purple tier. Many other counties moved into the orange tier from the red tier, and we're well on our way to a green tier in a foreseeable future. We're at 2% positivity today. There's only a couple states in America with lower positivity rate than the state of California. Our cases, a little over 2,200 today, showing stabilization as we've seen massive decompression in our hospitals and our ICUs as well. So these are encouraging signs, but we're mindful. We're monitoring 474 individuals that we have sequenced their genomes that have the UK variant. We now have 6 variants, 6 mutations from the Brazilian variant in the state, 4 from South Africa. We have a number of New York variants in California, and we have our own homegrown mutation, which is referred to as the West Coast variant. 8,800 as of today have been sequenced. These mutations should make us mindful of the moment we're in. This is not mission accomplished. We're not spiking the football. This is not time to take down your guard or literally, as is the case, take off your mask. The most potent and powerful thing you can continue to do is wear a face covering and let us work through the next number of weeks until we get to that place of abundance, moving away from the scarcity mindset where we can meaningfully begin to reopen the economy without the kinds of modifications that we're currently experiencing. Final 2 points. The mayor was right to point this out. Our small businesses have been impacted, terribly so, particularly in the hospitality and leisure industry. And while the economy in California is growing, and while the state is enjoying record reserves, and while the state is enjoying one of its highest operating surpluses in our history, including just this week announcement that we have $14.3 billion more in cash than we anticipated in January, we are mindful that that economic reality for small businesses looks very differently. And that's why we put up $2.5 billion of grants, not loans. And we encourage our small businesses to learn more about that grant program. Tens of thousands of businesses have already received grants, $5,000 to $25,000, nonprofits, cultural institutions, all eligible for those grants. And we are committed to doing even more as we update our budget in May to continue to help support our small business to get back on their feet. 9,000+ schools now in the state of California have either opened or have set a date to open. 9,000 of the 11,000 will update on Friday, tomorrow, that number with more granularity. So you'll see school by school, not just district by district. And we are also seeing very, very positive signs across the spectrum as it relates to people feeling more optimistic, not only about their small business, the fact that reopening, about their schools reopening, but more and more confidence in their ability to once again breathe and once again feel a sense of optimism about their fate and future. And so, Mr. Mayor, I appreciate your comment about California, because one thing I know about what's going to happen in the state, we're not going to come back. We're going to come roaring back. Mark my words. This state is going to come roaring back. Bright light at the end of the tunnel. And it's folks like yourself that are doing incredible work every single day that are helping us get just one step closer to that day. And so thank you again to Ultimed, and thank you, Mr. Mayor, for your incredible leadership. And with that, we're happy to answer any questions.
Take up the first question right here.
Governor Vicky Vargas from NBCLA. Jumping off the concerns as we move through these tiers, a lot of questions remain. Even on what's printed out today, the yellow tier does not allow for 100% of anything. You use the term green tier, which was new to us. And secondarily, beyond small businesses, for example, City of Anaheim has announced they have to take out a $200 million loan based on the losses to the tourism industry, hotel bed taxes, all the things that they lost. So what do you say to those who are going to be struggling for a long time, and when will crystal ball, when will all of this end?
Well, we'll end when the pandemic's behind us. It will end when we defeat this virus. The fastest way to get back to where we once were is to eliminate this virus. This virus continues to be deadly. Today, we had over 200 people's lives lost to this pandemic. It's just a reminder that this is still taking people every single day. Thousands of people are dying because of this virus all around the globe. This is a deadly and serious virus. It's not taking spring break away. It's not taking the summer off. We have to defeat it. And we've made progress as a country, but you're seeing that progress as setback in a number of other states that are seeing positivity rates go back up. Some of those larger states, Florida, Texas, have multiples of positivity rate compared to California. When you say pull off your mask, let's just go back and revert to normal, then that puts the virus back in control, as opposed to the work that all of you are doing to keep this virus at bay. I want to keep that progress. We're not going to run that 90-yard dash. And so we've got a lot more work to do in the next number of weeks. Almost 16 million vaccines now have been administered. No other state comes close. More and more vaccines coming in. We're going to eliminate these restrictions, make it available to everybody just in a few weeks. Businesses are reopening all up and down the state of California. We're going to update those tiers. We're going to eliminate these 4 colors, get to a new tier, this green tier. We've been talking about that for the last 3 weeks. We're working on what that looks like, mindful of these variants, mindful of these mutations, mindful of what's happening in Europe, mindful of what's happening in other parts of the state, of the country, and other states in this country, and mindful that we need to do all of this together. Because when we come out of this tunnel, I want to come out together. I don't want just certain folks coming out of this tunnel. I want all of us coming out of the tunnel. That's why equity is that North Star. So it relates to the issue of finances. Big deal what just happened in the federal government. And I'm sure you guys have done the math and done the reporting. $42 billion will be injected just for state and local government to help address some of those loan issues, offset those local constraints and concerns. The mayor was just telling me about the money that's coming directly into Santa Ana, which is substantial. So we are looking forward. We're running surpluses. The state has been running with fiscal discipline, running record reserves, bond ratings the highest it's been in 2 decades. We're paying down pension obligations, $9.5 billion over the next few years. No other state in the country I know is putting $10 billion in general fund into paying long-term obligations. We're making progress, and now we're also the beneficiary of this stimulus, which will allow us to support cities, counties, communities, and businesses even more. Forgive that was a long answer, and you got to do a soundbite, so forgive me, but deserved a comprehensive response.
Hi, Governor. Chip Yost with KTLA. Kind of a follow-up to that question and some of your comments there. The recall effort is obviously making a big a deal about the closures during this whole pandemic. Looking back now with the benefit of being able to look back, do you have any regrets about the closures and some of the restrictions and orders you put in place during the pandemic? Would you have done anything different, maybe loosened up a little on some of the restrictions, knowing what you know now?
Well, at the end of the day, California, because we were the first in the nation to do the stay-at-home order, saved thousands and thousands of lives. And that's objectively considered. Those aren't my words. Those are the words of the experts. We have among the lowest death rates of any large state in America. And we are poised to have a comeback, and this has been independently analyzed, a comeback that no other state in the country will enjoy in terms of our economic growth and recovery. So I think the state handled extraordinarily well with a mindset on science, evidence, using data, and having a health frame. And I know a lot of other states are struggling still. A lot of states are running massive deficits. A lot of other states have huge death rates that are exponentially larger than California. Large other states are not as well positioned for a full recovery as the state of California. So I want to compliment Dr. Gallies here and our team for their counsel and advice, and also all the local health officers up and down the state that I think deserve extraordinary amount of credit. I think we're all geniuses, not just experts in hindsight. And so, one of the great challenges and struggles in life is the nature of a virus that, is stubborn. It's humbling. The word of the year is humility. And these mutations only reinforce that. I mean, just imagine being leaders in places like Italy, Germany. They're doing full lockdowns again, having to struggle with all these mutations. We're going into something, unless you were around 100 years ago, no one's ever experienced in a lifetime. And so all of that requires in real time decisions that are challenging, and you're constantly evaluating those. And we're constantly evaluating our decisions and improving and iterating and making sure we're adjusting. That the tiered models, those color tiered models, are a perfect example of that. Those came about 28 weeks ago. They didn't come in the beginning. So it's all part of the iteration and all part of this journey that we've been on internationally, not just here as Californians together.
Jessica De Nova with ABC7 Eyewitness News. Bienvenido, Gobernador. Welcome to my hometown. So I grew up here in Orange County, and I grew up undocumented. So I know firsthand the fear, sometimes shame that comes with having to prove identity and having to provide proof of residence for undocumented communities. Having grown up here, I also know that a lot of our food vendors and child care providers are undocumented. That's the only way they can make a living. So as we moved forward to tier eligibility, I wondered how will they be required to provide identity, proof of employment, proof of residence. I asked the county, I asked several providers, and no one could give me a clear, concise answer.
So as you know, one of the real impetus for the recall goes back to my advocacy on behalf of our diverse communities. You can actually read the petition. People, I hope, read it when they signed it, what they were signing. And it was because of our advocacy for our diverse communities. We take a back seat in no other state in the country, regardless of your immigration status, to have folks back. We provide health care up to age 26, regardless of that status. Testing, regardless of that status, no cost. We were one of the first to establish that firmly, foundationally, provide grants to people because so many living in mixed status families that were left out of the federal stimulus. And we provided 150 million in direct grants, raised philanthropic dollars, $50 million to help advance those efforts. We have $52.7 million of investments in community-based organizations to truly speak the language in our diverse communities across the spectrum. Talk about in-language cultural competency. We are redefining that. 337 community-based organizations are part of that effort, reaching out to communities, documented and undocumented, to help support our efforts in terms of vaccine distribution and availability. So our perspective is, from a health care perspective, we want everyone, regardless of their status, to get support. We have direct efforts for farm workers. I've been in the Central Valley a dozen times in the last few weeks, providing direct efforts, meeting people where they are, pop-up sites, mobile clinics, going in the farms, regardless of immigration status, no question asked, just getting shots into people's arms, stabilize population, stabilize health. Dr. Galley is here, and I want to ask Dr. Galley just to come up a little bit more to reinforce this important message and your important question, because I want folks to understand their opportunity to access the vaccines and our moral responsibility to provide them in a timely and equitable manner.
Governor Newsom, can I do a follow-up really quick? Afterward, thank you.
Thank you, Governor. Thanks for the question. As the governor said, our objective today is to make announcements that show that we're taking down barriers to access of the vaccine. One of those is showing documentation. We made a decision that self-attestation around disabilities and chronic conditions was enough. So we didn't burden people with, hey, where's my paperwork? Go get a note from my physician to show that I'm eligible. Similarly, we want to make sure as we move to 50 and older, 16 and older, that anyone comes free of documentation who's eligible to be vaccinated. So I'm careful, I'm a pediatrician, want to make sure that people are 16 and older, that we're not vaccinating kids. But that's going to be the only threshold. We want to make sure we get this available, no questions asked, whether it's working with employers, working at fantastic community partners like Ultimed or any of our FQHCs or our public hospital systems. This is particularly important, as the governor said, around the equity frame, around our framework to make sure hard-hit communities hear us loud and clear that when there's interest, ask questions, come with your questions, but ultimately we hope you get vaccinated. And whatever we can do to take down that barrier, whether documentation status is an issue, please, please, please know that we're here to work through that and make sure that every Californian is vaccinated as quickly as possible. And this idea that we have to get people vaccinated as we see surges in other parts of the country, surges in other parts of the globe, that it really is in some ways a race of vaccines against variants, that we need to do this quickly. And that's why today's announcements around eligibility are important, looking for that supply to come through, and then doing the really hard work in communities to get the message right, to make sure the messenger's right, and people trust in the institutions and the vaccine to get us through this.
I am Castulo de la Rocha, President and CEO of Ultimate Health Services Corporation. We're a federally qualified community health center. We operate both in Orange County and Los Angeles. Like Ultimate, there are another 1,500 organizations statewide. Through those community health centers, close to about 7.6 million people are served through community health centers statewide. About 55% of that population is Latino up and down the state of California. One of the things that distinguishes our organization from private practices and the sort is that, in fact, we provide services regardless of people's ability to pay and or legal status in the United States. That's not a question that we have ever asked or ever intend to ask any of our patients here. I will tell you that the support that we have received from the state of California, from the office of the governor, from the office of the secretary here, the support to maintain the infrastructure. We're also small businesses. We operate organizations on low budgets, and many of us depend on federal support and state support. The support that we have received continuously from the state of California and from the federal government has maintained our operations at a level that allows us to continue to remain open at any time that the services are needed in our community. Our commitment, Mr. Governor, Mr. Secretary, community health centers are here at your service and at the services of our community. Thank you.
Thank you, Dr. Galley and President De La Rocha. Governor Newsom, my question was about oversight. So you have made it very clear that you are here to help the undocumented community. But we did get reports of undocumented folks going to the private sector to be vaccinated, only to be turned away, specifically Rite Aid. Rite Aid has since apologized and vaccinated those community members. But who is responsible for oversight if our undocumented folks face this again moving forward, if they're turned away because they can't provide documentation?
When you have your secretary here and your pediatrician and doctor, take advantage.
Yeah, thank you. First off, we take very seriously all of the partners as one of the key distributors of vaccines, the state, to all of the partners that are doing the hard work like Ultimed and many other community health centers of vaccinating. We need to hear about that, and we take responsibility to work with those partners. I'll remind you that the state, as well as the federal government, is distributing directly to pharmacies. So working with our federal partners when we hear of issues to make sure that we correct it. It's good to hear that it was corrected immediately. And if things like this come up in the future, it is directly against what we are standing for today, which is low barrier, no barrier vaccination opportunities for all Californians. So the state does take that responsibility seriously, and working through our county partners and others to make sure if those stories do occur, as the one you're noting now, that we intervene and work with those vaccination partners to make sure the barriers are taken down right away.
Governor Mike Blood with AP. I'm wondering, your health secretary a few weeks ago indicated it would probably be May 1st before you opened up eligibility to allow you to meet your equity goals. I'm wondering what happened during that time that's allowed you to advance that schedule. And secondly, with so many governors opening up around the country, I'm just wondering, did you feel any pressure at all looking around at other states, or was that not relevant to your decision?
We're guided by the data, by the science. We have a tiering system that allows us to toggle forward and toggle back. So we haven't fundamentally changed that. We did add an equity component as it relates to vaccines that allow us to move more quickly through the tiers, which we think is appropriate based upon the nature of this disease and the virus as it relates to the total number of people that have antibodies because they've been exposed, and the total number of people that are beneficiaries of the vaccines that create a natural lid. So on that basis, using the expertise and the examples of other counties and countries, as well as other states, and looking at health officers and all the data that's come in on that basis, we felt that that was appropriate in terms of allowing us to move more quickly through tiers. But again, if we see a disease prevalence and we see these numbers start to go back up the way we framed this, we have the ability to move back. So no is the answer to that question. As it relates to the issue of the first question, abundance is the answer. We were given assurances publicly and privately around J&J vaccines that were more promising than we had understood just a few weeks ago. That was reinforced on a call with governors by the Biden administration, reinforced again this week. President today, even in his press conference, announcing now his more audacious goal, 200 million, not just 100 million doses administered in his first 100 days, only reinforcing that paradigm. So our ability to do more has always been constrained by supply, manufactured supply. We have confidence now in the manufactured supply becoming available sooner than we had anticipated.
Drew Van Voors with the Epic Times. How do you respond to reports that the recall has been a bipartisan effort?
Well, the principal sponsor of the recall has stated that he believes that immigrants should have tags of sorts. Said that they work for stray animals, I think was his language, not mine. That's the principal proponent of the recall. Other advocates are members of the 3%, 3%ers, white supremacist group. These are the principal proponents of this effort. These are not folks I align with in any way, shape, or form. I find their views just completely antithetical to everything this state represents and what we're about. There are people that signed that I have deep respect and empathy for, that have been frustrated. This has been a hard year for all of us. I'm a parent of 4 young kids. I can attest to that, the impact it's had disproportionately on my wife and women all across the state, particularly single mothers. I grew up, my mom was a teenage mom, raised me and my sister on her own. And that stress is palpable and it's real, it's understandable. And so that frustration is expressed. So I understand that, but you got to know where the origins of this thing lie. And those facts are stubborn facts and they're in evidence and they're overwhelming. And I just think people should learn more about that when they consider what this effort is really about.
Okay, thank you, everybody.
Is that it? Great, thanks so. Thank you, sir.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.